We hear a lot these days about stem cell therapy and how it really seems to be revolutionizing the treatment of certain conditions. Well, what exactly is the science behind it? Well, Dr. Tracy Linhart from Peaks of Health is back to discuss this. I think you gave yourself the last time you were here a title of Stem Cell Queen. Stem Cell Queen. So we'll start out with that. But stem cells, I mean, you hear a lot of people either wanting it, thinking they need it. Let's just discuss, what is the basics of stem cell therapy?
Well, the main point is we all have stem cells in our body. You know, we're born with a certain amount of stem cells. You know, we have stem cells almost in every part of our body to regenerate and regrow things and repair things. As we get older, less of them. So it's one way that we can use to repair tissue. For instance, with me, I do joint injections. So injuries to ligaments and tendons and things like that of the joints, we can get repaired that way instead of using surgery all the time. So it is a way to prevent surgery in some people, backs, necks, things like that. Some of the things that are coming out, I mean, they just finished a study up on congestive heart failure, where they're injecting the stem cells directly into the heart muscle. The results are going to be phenomenal. I already know what they are when they get published. It's going to be a game changer for congestive heart failure patients. They have one study that's in phase 3 trials for macular degeneration, which is when you lose your eyesight, and they're actually injecting the macula, so they're actually putting the stem cells in the eye itself. And they're getting, again, these people that are 22,000 who can't see shadows in front of their face are getting to 2100, 2050 vision. So again, I think that when that gets published after phase 3 trials, that's going to be a game changer. Cervical spinal injuries. They have a clinic in Malaysia that is injecting the actual injury within days of the actual injury itself. And they go right into the spinal cord. And these people are walking now within several months, who will be in wheelchairs. And I got to meet a patient that was in a wheelchair for 5 years, so now they're starting to see what would happen when they inject after the fact. He got his first injection, he can now move his arms. 5 years in a wheelchair as a quad. So I think in those instances, when it's picked correctly, and we are trying to see where it will work and where it won't work, then it is a game changer for those people.
And you were very honest when we started talking about stem cell therapy that you see some patients and they think, oh, stem cell therapy, that's what I want. But you pick and choose. And so I kind of want to get back to that point that you were saying, that you really listen to your patients, and sometimes that might not be the best option.
Well, the thing is, stem cells, usually are not going to hurt you, but they're very expensive. So if that person doesn't need something that expensive, why would I give it to them? If something else will work just as well or better? So again, I pick and choose, and I educate my patients as to, here are all your options. Now, some patients may just want it, and that's perfectly fine because it'll do the job for what they're looking for. But if another alternative is there, I want to make sure they have all their alternatives. I think a lot of people are just injecting them into everybody for everything, and then you're not going to get the result you're looking for. You want to make sure you're doing it for the right reason.
And I love that about you. And I love, too, I was actually, when she sat down, I was like, so where have you been? Because you travel all over the world giving lectures and, of course, learning. So when it does come to what's next for stem cell therapy, you're going to be right there.
Yeah, I'm so fortunate because I do get to speak at a lot of conferences, and most of those conferences I attend at the same time. So I get to hear what everybody else is doing. So it's really kind of cool to stay on the cutting edge of everything. And we have a network. When I go to these conferences, we network with each other, so we have ideas that we can fly. So I have a lot of people that I communicate with that kind of keep me up to date on what's going on. We'll send articles back and forth to each other that we find. So it's amazing what I get to see and learn by doing what I do.
And if people are watching at home and maybe they were interested in stem cell for an injury they have, what do you want people out there to know?
I mean, really ask questions. Where are you getting your stem cells from? How much am I getting? What kind of stem cells? Because you can get stem cells by drawing off the adipose tissue, the fat. It's kind of like a liposuction. And then you sort through and give them their own stem cells back. You can get stem cells through bone marrow, where they actually do a bone marrow as if we actually are doing regular bone marrow. So they pull your bone marrow out of your hip. And then the stem cells that I like to use are umbilical cord stem cells. Because, one, they're undifferentiated, they're infant, and I can get higher counts on them. But you got to make sure when you get them, you're getting them from a certified, bank. We get ours from an FDA-approved bank from the university. So we have the counts, they're certified, they've been checked, they've been verified.
Again, just questions that I would have never thought to ask, and maybe you've got some more questions. Well, you're lucky because right now is a really good time to give Dr. Tracy Linhart a call. There's the phone number you see on your screen, and you'll also get a free 15-minute consultation if you mention the Morning Blend. As always, thanks for coming on.